So hi, good morning. So today, my name is Daniel P. Molina. I will be reporting for the ethical. How do you practice ethical practice and standards? Then I will report about the ethical PSN practice standards with integrity. So next slide. So for the introduction of this report, ethics and BSN, anatomy and nursing practice, benefits and non-beneficial nursing practice, justice in nursing practice, ethical dilemmas in nursing practice. Conclusion. Introduction to ethics and BSN. Ethics is a crucial aspect of nursing practice that involves making decisions based on moral principles. As a nurse, it is essential to practice ethics to ensure that to provide quality care to the patients. So you must be familiarized with yourself and with the ethical guidelines. Educate yourself about the ethical guidelines and codes conduct relevant to your profession. This may include codes provide professional organization, regulatory bodies, and listening boards. So, the Bachelor of Science in Nursing BS programs, students are taught the ethical principles and standards that guides their practice. So, the practice these principles includes anatomy, beneficence to non-beneficent, justice, ethical principles, standards, BS ensure that the nurses provides patient-centered care while upholding the highest ethical standards. So, to the respect of the anatomy of confidentiality, respect the anatomy and provide individuals of our care. Obtain informed consent before providing any treatment or care, and ensure confidentiality of personal and sensitive information. This includes stereotyping. Next slide. Beneficial and non-beneficial manifested in nursing practice. Beneficial in nursing practice that requires nurses to act the best interest in their patients. Non-manifested on their own requires the nurses to non-manifested. Other hand, requires the nurses to avoid causing harm to the patient. In BSN program, students are taught how balance and those practice providing the care and both beneficial to their patients. This includes to ensure that patients provide treatments, interventions when avoiding potential harm or adverse effect. Next slide. This maintains professional boundaries, establish and maintain appropriate professional boundaries with patients, colleagues, and other stakeholders. Avoid engaging in dual relationship that could provide compromise objective or create conflict interest. So, injustice in nursing practice. Justice in the nursing practice that requires nurses to provide care that is fair, established to all patients. This means that the nurses ensure that all patients have equal access to healthcare services regardless to their race, ethnicity, gender, or socio-economic status. In BSN program, students are taught how to provide care that is just equitable in recognizing and address any races, inequalities that may exist in healthcare system. This includes advocating for policies practices that promote social justice and equality in healthcare. This provides complement and stay updated with the current evidence-based practice and continually enhance our knowledge and skills taught continuing education. Provide care with our scope and practice ensure patient safety at all times. And then next slide. Make sure to provide safety and ensure our patient are at all times. So, what is this? Ethical dilemma in nursing. Ethical dilemma in nursing. Ethical dilemma in nursing practice. Nurses often face ethical dilemmas in their practice that requires them to make difficult decisions. These dilemmas may arise when there is a conflict between two or more ethical principles. Or when they are essentially about right course of action. In PSM programs, students are taught how to identify and address ethical dilemmas in their practice by using ethical decision-making frameworks. These frameworks help nurses to analyze situations, consider all the relevant ethical principles, make informed decisions. This is the best interest of their patient. This practical cultural sensitivity and diversity, it recognizes and respects the diverse of practice, patient backgrounds, beliefs and values, provide cultural and sensitive care that is insecure, provide discrimination or bias. It acts as an intermediary and honesty, demonstrate honesty and integrity and accountability to your profession, transparent education, maintain accurate records and report any errors or incidents permanently. So next slide. In conclusion, practicing ethics in essential nurses to provide quality care to patient in BSN program. Students are taught ethical principles, standards that guide their patients and ensure they provide patient-centered care while upholding the highest ethical standard. By respecting patients' anatomy and balancing evidence beneficials, by respecting anatomy balance, promoting justice and equality, and using ethical decision-making framework to address ethical dilemmas, nurses can ensure that they can provide safe and effective care that meets with their patients. Seek consultation and collaboration when faced with unethical dilemmas or complex situations. Seek consultation from colleges, supervisor or ethics committees. Collaborate with interdisciplinary teams, address ethical concerns and make decisions in the best interest of patient. Reflect on ethical challenges, engage in self-reflection and ongoing ethical self-assessment. Continually elevate our own values based in ethical decision-making process and enhance ethical awareness and competence. Report ethical violations. If you become aware of ethical violation and misconduct, follow the appropriate reporting process procedures outlined by organization or regulatory body. Uphold professional standards by reporting concerns and supporting ethical accountability. Remember that ethical practice is a continuous process that requires ongoing self-reflection, education, and commitment. By integrating ethical principles into your practice, you contribute to maintaining the integrity and trustworthiness of your profession to ensure the best possible care of your patients.